Tēnā tātou katoa. Ka tika me mihi atu au koutou katoa e hui maina I roto I ngā tūmanakohanga mō tō tātou hauora āiwi. Kia ora, ko David Tipene-Leach taku ingoa. No pōranga hauahau, no Ngāti Kere, no Ngāti Kahungunu. Mo hia nei te roa, e mahi ana I roto I te ao hauora. No reira kei nā koutou, kia ora tātou. I think to begin with, what we need to be thinking about is that people have to be able to have a fair start. And you know, in the health field, we're talking about social determinants of health, we're talking about historical trauma, we're talking about institutional racism, and we're talking about the activities of individual medical practitioners and other health practitioners around cultural competence and cultural safety. So the big aspiration is, at some stage, equity is top and front of all of the activities that we imagine over the next generation, the next period of time, but that we look realistically at what part and what role the various contributors to inequity actually do. And we realise that health services proper probably account for 15 to 20% of the inequity that we have to deal with at the sharp end. Well, firstly, I think it's great that we've got some health service change coming up. But you know, I think that we need to realise that we've been here before and that we wouldn't be surprised if we were all a little bit cynical around the way in which health service change actually produces outcome for Māori and the way that it deals to inequity. So I don't think that we have confidence that change is what it's all about. If we just go back to the social determinants of health, I think that the first thing that we need to get done is we need to have a government who is brave enough and robust enough to deal with income disparity. You just can't get away from that. We need to deal with poverty. We know the contribution of poverty to our health problems, and that's really important. I think that we need to find a real way of redoing Māori co-governance of health institutions. We don't do this well at all, and we need to take a good, long, hard look at Māori co-governance. There is no, we just all know that if you don't get it right at the top, then things are allowed to slip all the way through. So co-governance is really important. One of the good things that we've done in New Zealand is that we now have some sort of parity for Māori medical students in both of our medical schools. I mean, this is just unheard of in the world. This is an amazing piece of work. It's a great piece of work. What we've now got is that we've now got the colleges, our medical colleges, our surgical colleges, our specialist colleges are now following up on this work, and they are struggling with good heart to establish the appropriate training programs and the appropriate entry programs to make sure that we have the right health workforce, both in terms of number of Māori and in terms of cultural safety and cultural competence amongst the non-Māori members of our workforce. If we were to be able to turn cultural safety audits of our clinical outcomes into business as usual, and if people were happy to discuss their shortcomings amongst their colleagues, then we would be making huge steps. So cultural competence, cultural safety, really important, but the clinical audit against ethnicity is the thing that tells us how well we are or aren't performing. So the three things that I think are about working together and that we have some opportunity to do well is the co-governance question. We are moving in that direction. The government has seen fit to move in that direction. If the politicians move in that direction, then of course the bureaucrats move in that direction. My problem is that bureaucrats are a little bit fixed in their behaviours and their thinking, and they're holding on to situations, maintaining situations as they are. And so I think that they're going to need a little bit of work and a little bit of freeing up. But nevertheless, co-governance, we've got some opportunity here. Nō reira, koe nei hoki wāku e hia nei ki te suku atu ki a tātou te rangi nei, nō reira kia pai hoki wako tau nā mahi i tēnei rangi, te nā kōtau, kia ora tātou.